And then just kindly, if you need to step away from your desk or the telephone, please don't put us on hold. And also, if you can just kindly put us on mute so everybody can take advantage of the presentation. Okay, so the benefits that we're going to review today are going to begin January 1st, 2020, and they will roll until December 31st, 2020. Who is eligible for benefits? You yourself, if you work 30 plus hours, and your legal spouse, domestic partner, and children up to the age of 26. And as I stated earlier, these benefits begin on January 1st until the end of the year. You are locked in for those 12 months unless you experience a qualifying event. Some examples are noted here: marriage, divorce, loss of coverage, death of a spouse or a dependent. Make sure you notify your human resource team within 31 days of the date of the event, so you have the ability to go in and review your options, enroll, or terminate coverage. If you exceed the 31 days, then you do have to wait until the next open enrollment period to make any changes. Okay, we're going to go over the medical plans. No changes to the medical plans. They're same medical plans. No changes to the out-of-pocket, copays, etc. So all that remained the same. So the first plan that's available is the Open Access Managed Choice. Again, these plans are under Aetna, under the network Open Access Managed Choice. This is a $6,350 deductible as an individual, $12,700 as a family. Now, if you should meet your deductible on this plan, you've also met your out-of-pocket max, which means your worst case scenario, maximum exposure, if you will, in a calendar year. So if you happen to have surgeries, procedures, tests done, and you meet that, then you're being to 100% within the network and in the calendar year. What applies to deductible on this plan is going to be your urgent care, your emergency room services, your inpatient, outpatient testing, and specialist visits. Those all are going to be subject to your deductible first. So that's before Aetna will start to pay on your behalf. On this plan, as in all of the plans, your preventative care is going to be covered at 100%. So your well woman check, well man check, well child check, those are all covered along with any testing that go with preventative care. On this plan, if you need to see your doctor, this is a regular doctor visit. It's going to be a $25 copay, and that's going to include your walk-in clinic or convenience care clinics and CVS and Fry's, those types of clinics, and also your telemedicine provider. That's going to be a $25 copay. As I stated earlier, on this plan, the specialist is going to be subject to your deductible along with your urgent care and emergency room. So what that looks like is you still want to make sure you show your Aetna ID card. You will pay the contracted negotiated rate with those providers, and all the amount will go towards your deductible and out-of-pocket max eventually. Okay, and then you do have a 30-day retail supply for copays. So it's either going to be a $3 copay or a $10 copay. Your preferred brand name is going to be a $35 copay, and your non-preferred medication $60. And then your specialty drugs, you're going to pay 25% of the retail up to $250. And then you have mail order available on all the plans. So 90 days worth of medication for 2 copays, so a little bit of savings there. But you do have to utilize the Aetna mail order service. Any questions on this plan? Okay, the next plan. Okay, thank you. Your next plan is the Aetna Open Access Managed Choice 3500 HDHP. So this is a high deductible health plan. What that means is that everything is subject to your deductible with the exception of your preventative care, maintenance drugs, and FDA-approved contraceptives. Everything else is going to be subject to your deductible, your office visits, your specialist visits, any testing non-related to preventative, and any medications not related to preventative or contraceptives. Everything else is going to be subject to your deductible. So this plan also allows you to open up a health savings account. So pre-tax dollars that you put into an account to utilize towards medical expenses, medical, dental, vision for yourself and dependents. And then we'll go over that HSA account here in the next couple of screens. Does anybody have any questions on the high deductible health plan?
No.
Okay. So your last plan is the Open Access Managed Choice 1000, 1000 being the individual deductible and 2000 being the family deductible. On this plan, if you meet your deductible, you're going to go into the cost share or co-insurance with Aetna. So you're going to pick up 20% of the cost until you reach that maximum out of pocket, which is $4,000 and $8,000 on this plan. Your preventative care, again, is covered at 100%. Your office visits, again, your regular sick visits, your walk-in convenience care clinics, and your telemedicine provider are going to be a $25 copay. Your specialists are going to be a $50 copay. Now, with all of our plans, you can self-refer to specialists. You do not need a referral from your primary care physician in order to set an appointment with those specialists. So you can do that on your own. This plan does have copays for your urgent care at $75 and your emergency room is $250. Now keep in mind on this plan, if you go to the ER and you are admitted, which means you will be spending the night, they will waive the $250, but at that point you will start to pay towards your deductible. Okay, and then again, you have the same pharmacy available, and the pharmacy is available prior to the deductible. Again, that is for all types of medications, generic, preferred brand name, non-preferred brand name, your specialty drugs, and you also have that 90-day mail order available to you. Any questions on this medical plan?
No.
Okay, we're going to go over the HSA. So the HSA is a health savings account that you open that you put in pre-tax dollars. So that how that helps you is lowers your taxable income, so you have more money in your pocket. So that money goes into an account as it's deducted per pay period into your account. I'm sorry. There is no minimum, but there are some maximum under IRS rules. So under IRS rules, the maximum you can set aside in a calendar year as an individual is $3,550, and as a family, $7,100. If you are 55 plus, you can add an additional $1,000 to that, so making it $4,550 and $8,100. And again, hi, can you kindly put us on mute?
Oh, weren't we on mute?
No. Thank you. Again, these are pre-tax dollars, again, helping with lowering your taxable income. The money goes into an account as it's deducted from your check to use towards all medically qualified expenses, medical, dental, vision for you and dependents. Now, this money is your money. It's 100% portable, which means if you ever leave the company, that money goes with you. There is no use it or lose it provision with this type of account. Some caveats though, you do need to enroll in the high deductible health plan, which you have being offered here. You cannot be enrolled in any part of Medicare. You cannot be somebody else's dependent on their tax returns, and you cannot be enrolled in any other non-qualified plan. So make sure that none of those things apply to you, and then if you enroll in the high deductible health plan, you can take advantage of the HSA and start saving money for your future health needs. You also have access to the healthcare FSA or flexible spending account, better known as an FSA. So again, these are pre-tax dollars that you set aside that go into an account. Similar to the HSA, they're pre-tax, but the money is front-loaded, so you get a Visa card similar to the one on the screen with the full amount that you elected ready to utilize in January. So if you're planning LASIK surgery procedures done or paying for braces for a child or for yourself, you can have that money ready to go in January, and then it's deducted per pay period for the next 12 months. A few things on this account though, if you leave the company, you cannot take that with you. It stays behind unless you COBRA the benefit. And then additionally, there's a $500 carryover provision, which means if, let's say you elected the full $2,500 and on December 31st, 2020, you had $700 in there, you would forfeit $200. You can only carry over $500 into the 2021 plan year. So just a few differences there between the HSA and the FSA. Also, if you enroll in the high deductible health plan, you do not qualify for the FSA. You have to open your HSA, or you don't have to, but it's recommended. Again, your flexible spending account you can use for your copays for yourself and dependents. You do not have to enroll in any of the plans that are being offered in order to enroll in the FSA. It's a standalone product, and you can enroll just in this if you wanted to. You also have access to the Dependent Care FSA. Again, pre-tax dollars you utilize to pay for daycare services for children or elderly. And this comes out of your check per pay period and put into an account to utilize as it accumulates in that account. Any questions on these plans? Okay. Just some Aetna resources and reminders. You have the nurse on call 24/7, 365. You can utilize this line anytime. The nurses will have access to your medical records, prescriptions, diagnoses, things of that nature, and they will be able to speak to you in regards to drug interaction, side effects, etc., and give recommendations in regards to going to seek care. You also have discounts available, some wellness coaching and gym membership discounts. They partner with a lot of gyms in the Valley, so the gym you belong to may already be part of the plan and take advantage of those discounts. And Aetna did introduce a new wellness program. Some of you may have received a mailer, and it's called Attain. If you haven't received a mailer, you will get something in the mail. It's a partnership between Aetna and Apple. So it's a good way to get a watch if you don't have one, or get a new one. But it is restricted to iPhone right now. So there's more information to follow on that. Aetna also has the mobile app that you can download to your phone and you can have your ID card on there, find a pharmacy that's closest to you, and urgent care, things of that nature. And then, of course, the teledoc is available, and the copays are determined by what plan you enroll in. Now, if you enroll in the high deductible health plan, your copay is going to be $45. Okay, I do recommend you go online and set up the account prior to utilizing it, as they'll want some information from you in a form of payment. But there's general medicine available, so anything that you walk into, let's say a walk-in clinic, you can have a telephone or Skype conversation with a board-certified physician. They treat sinus infections, colds, flus, earaches, pink eye, sore throats, UTIs, rashes, things of that nature. You also have dermatology, psychiatry, and psychologists available through the teledoc.
Letitia.
Yes.
It's Valerie. Do we have to use Teledoc? Is that the only contracted telemedicine vendor that you have?
This is the one that we utilize that's connected to Aetna. We do have MD Live, and some people may have that already. And if you don't have it, I can send out a flyer. So the MD Live is a standalone telemedicine provider, and it's an $18 annual fee, and there are no other copays involved. Right now with MD Live, there are no specialists, strictly the general medicine. So I can send out a flyer with instructions to you, Valerie, and then you can send it out to the team.
We have our own telemedicine program. Can we utilize our own telemedicine program?
Of course.
And then will that be considered out of network, or what will that be?
Well, it's not going to be tied to a network since it's a standalone.
Oh, okay.
Yep.
And then how does the pricing look for that?
That depends. I don't have any information on your standalone. So if you,
okay, thank you.
You're welcome. We're going to go over the dental plans. There is a change in 2020 for the dental plans. They are no longer going to be Aetna. So Aetna is going away end of this year. The new dental plans are with Delta Dental. So the first plan is a PPO plan. You have an annual maximum of $1,500 to utilize towards dental services for yourself and anybody enrolled, all dependents. You also have preventive care services covered at 100%. Your basic services, such as a cavity, it's a cost share, so you'll pick up 20% of the cost, and Delta 80%. Major services, such as a Crown, it's a 50-50 cost share. Now, if you access the basic or major services, you will be subject to a one-time deductible of $50 as an individual or $150 as a family. If you never utilize the basic or major services, you will never be subject to the deductible. Now, the preventative care service covers your cleanings twice a year, your x-rays. Now, if you have certain medical conditions, high blood pressure, coronary heart disease, you're going to kind of chemo radiation, or are pregnant, you get an extra cleaning at no extra cost. So if you fall into any of those categories, once you get your Delta Dental ID card, I do recommend you go onto their website and see what's available to you. It is on the honor system, so the providers don't require anything from your physician in writing in order to give you that third cleaning. Then on this plan, there is child orthodontia available, and that's on the PPO plan. So that's an enhancement. And then if you notice on the screen, the in and out of network on the PPO plan are exactly the same. So Delta Dental will pay the same regardless of what dentist you go to. The difference with going to an out of network provider is that you can be subject to balance billing. And then the second plan that we have is a DHMO plan. This plan is similar to today's Aetna DMO plan. You do have to pick a provider, and every person enrolled in the plan may have their own provider. You can change it at any time. If you don't pick a provider and you enroll in the DHMO plan, Delta Dental will assign one to you and your family based on your home zip code. Again, you can change it at any time. So as long as you call or go online before the 25th of the current month, that new provider will be available for the first of the following month. Now, if you're enrolled today on the Aetna DMO plan and you have a child undergoing orthodontic services, you have to let us know, or your HR representative here at CBR know, so they can send you out a special form. Delta Dental has agreed to pick up those services, no loss, no gain. So if you've already paid your $2,400 copay, you don't need to pay anything else. If you paid $1,000 and all you have is $1,400 to pay, that's what you're going to continue to pay, and Delta Dental will pick up the rest with that provider, whether it's in network or out of network. But you do have to enroll in the DHMO program again. So you have to reach out to us and let us know ahead of time so we can coordinate that with Delta Dental. So the DHMO plan, again, no annual deductible on this plan. Your cleanings are covered twice a year, x-rays, and then additional cleanings are at a $45 copay. Everything else is going to be at a fee schedule. So your child orthodontia, adult orthodontia, everything is now a fee schedule. So I believe I attached that in the email that went out. So review that and review all the codes. All the dental codes are on there. It's very important that you designate a dentist, because those dentists have agreed not to charge more than what is listed on that package that you received. Look at the D code if you need to have something done, implants, root canal, crowns, major services done. You can see on there what it will cost you out of pocket. You may use your HSA dollars and your FSA dollars to pay for these services. Also, the Delta Dental plans do not have a waiting period for major services or any services. So if you're not covered today and you enroll in January, you want to go get an implant, you may do so. They also don't have a missing tooth clause, which means a lot of insurance carriers, including Aetna, if you lost a tooth while you were covered under Aetna, they would cover it. If you didn't lose it while covered under Aetna, they would not cover it. So Delta Dental does not have that exclusion. So it's a really enriched benefit. Any questions on the Delta Dental plans?
Yes, this is Valerie Nelson. So on that annual maximum, I mean, that's not even a crown. So what does that mean?
So for the crown, it's going to be a major service. So you're going to pay half
Right.
of the cost, and Delta Dental will pay half of the cost. Again, deducting from that $1,500. So $1,500 will not be totally allocated to the crown. You're going to be responsible. So the crown could be $600. So you'll pay $300 of those costs.
And then, so say you had 2 or 3 crowns, you're gonna, I mean, the annual max would far exceed that. So then it would, the rest
Correct.
of it would be out of pocket.
Correct. So if you need a lot of dental services that way, and $1,500 max is only going to take you so far, maybe explore the DHMO, because it tells you
Right.
exactly how much a crown will cost you, and it may be less expensive to go that route, because it is one, less expensive for you, and then again, everything has a price associated with it. So if you need 3 or 4 of those, you know exactly how much your out of pocket is going to be. That I agree, the 1,500 doesn't really go a long way, but it does cover all of the services that are available, and you can plan those out.
All right, thank you.
You're welcome. If there are no other questions on the dental, we're going to move on to the vision. So the vision plan is the new iMed Vision Plan with a partnership with Delta Dental. So you probably received the attachment, and you'll see on the attachment that it says your frames are available every 12 months. That is correct. It's not 24 months, it's 12 months. So you still have your eye exams available every 12 months at a $10 copay. Your frames are now every 12 months versus 24 months. And then you get a $120 allowance to use towards those frames. Single vision, bifocal, and trifocals are now a $10 copay. And then also you'll look at that summary. All treatments to lenses are now a copay versus a percentage of cost, which includes a polycarbonate, tinting, things of that nature. It's all going to be a copay versus percentage. You'll have an $80 allowance to use towards your contact lenses. So vision carriers or vision insurance companies, you treat the contact lens and the lens for your frames exactly the same way. So you can have either or every 12 months, but not both. The iMed plan that starts in January does have some pretty good discounts if you want to get both in the same year, because you do have that frame allowance available every 12 months. So you can essentially get glasses every year covered. And then any medically prescribed contact lenses are going to be covered at 100%. You have the same providers, but the main difference now, it's called the the Insight Network versus the Select Network. So today it's called the Select. Effective January, it's going to be the Insight Network. And you should have that in your flyer. If you're missing any of that information, reach out to me and I'll be happy to send it. Next, we're going to go over the voluntary life and accidental death and dismemberment. So last time you were presented the Unum life insurance policy and you enrolled on a voluntary basis and you did not max out 5-time annual earnings, you can now increase if you would like to increase with no medical underwriting. If you're newly eligible or new hire. If you're newly eligible or a new hire, and this is the first time you're seeing the benefits, you also can take advantage of the guarantee issue, which means you can enroll up to 5-time annual earnings, up to $200,000 for yourself, $25,000 for your spouse, and $10,000 for the children with no medical underwriting. If you did not enroll the first time we presented this, unfortunately at this time you will be subject to a medical underwriting and you are required to complete evidence of insurability. Okay, it's still available, still very inexpensive because it is a large group benefit. So I did include that in the package. The very last 2 pages, I believe, of the enrollment packet have the rates and how to calculate how much it will cost. If you need help with that, we will be more than happy to help you figure that out. Okay, you also have the short-term and long-term disability available to you. So the short-term disability covers short and long-term disability cover you for off-the-job scenarios. So not on the job, so strictly off the job. So the short-term disability covers 60% of your pre-disability earnings up to $1,000 a week. The benefit begins after the 14th day of sickness, illness, or hospitalization. And then the benefit duration is 11 weeks. That's the maximum. There are some instances where it would be less. Pregnancy or delivery would be 1, depending on the type of delivery it is. There are some pre-existing limitations with both the short-term and long-term disability, which is 312, which means if on the effective date of the policy, which is going to be January 1st, you were treated, took medication for a condition in which you went out on leave in 2020, that would not be a compensable event, which means they would not pay you for that disability. If it's something unrelated, something completely different, or it's an accident, then it would be a compensable or paid event. The same applies for the long-term disability. So the long-term disability covers 60% of your pre-disability monthly earnings up to $7,500 a month. The elimination period, or the time in which it starts to pay, is 90 days, and this benefit lasts until normal Social Security retirement age. Any questions on the life insurance or disability programs? Okay. You also have AFLAC available to you. So AFLAC also offers short-term disability. If you are family planning in 2020, I invite you to reach out to Jose and compare the Unum short-term disability with AFLAC short-term disability. There are some differences. The AFLAC policies are a little bit more customizable, and you can extend the amount of time that you will be paid. So if you're planning on going out in 2020 for an event like that, then I do recommend that you call Jose, and he will either sit with you or have a telephonic conversation with you and go over these plans. Aside from the short-term disability, AFLAC covers you on and off the job. So if you get hurt at work, obviously it's a workers' comp issue, but on top of that, you can get coverage with AFLAC. So they have multiple accident plans. So accident covers you on and off. Accidents stemming from a paper cut to a broken limb, everything is covered under the accident plan. Additionally, some of their policies have a wellness benefit, which means if you go get your teeth cleaned or get your annual checkup, they will give you either $60 or $75 depending on the type of coverage that you have. Now, AFLAC is not insurance. AFLAC does not coordinate with the carriers. They don't have a network, nothing like that. They strictly pay based on the medical code and diagnosis that you receive. So if it's a cancer policy, based on the diagnosis is how they pay. Hospital plan, you can layer that on top of the short-term disability if you're going to be family planning. So they each pay separate of each other. So they don't even coordinate internally. Critical illness plus rider, so you add it on top of one of the other coverages. And the cancer policy does cover the family, the entire family, so an employee plus, so the children are automatically covered under that policy. So they're very customizable. Like I said, they're depending on your age and your family status, and some of them are smoker status. So if you're interested, I recommend you contact Jose either via email or his cell phone number. You can even text him, just tell him that, you know, the company you work for related to CVR, and he will meet with you and give you the rates that are for you, specifically for you. And also, if you enroll in any AFLAC products, when you enroll, you are locked into those rates. It will never change. Okay, any questions on AFLAC? Okay, so coming up on the end here, so just a reminder, everybody please complete an enrollment form and submit it by the 26th, no exceptions. If you're going to be waiving all coverages, please indicate that on your form and send that back to you. We are collecting waivers and enrollments, both. Your life and disability forms, if you are enrolling or making changes, is when you need to send them back. If you're not doing anything, you're currently enrolled and you just want to keep things as they are, you don't need to fill out any additional forms. The flexible spending account, or FSA, if you're on it today and want to be on it for 2020, you do need to complete that form. Or if you're enrolling for the first time, make sure you fill that out and send it to us as well. If you enroll in the high deductible health plan, please follow the instructions on your benefit guide, either page 8 or 9, on how to open up your account. Very important that it's open before the first of the year. One, so we have the account ready to put in your pre-tax deductions that you elect. And two, let's say you go to the doctor in January and you have a claim already and you don't open your account till February. So now you have money in that account. You cannot use those dollars for past claims. You can only use it for future claims. So if you're enrolling in the high deductible health plan, I highly recommend you open your account and let us know that it's open so we can put all of your pre-tax dollars in there. Does anybody have any questions, comments, or concerns, or need additional information on everything that we've covered today?
Oh.
Okay. I will send Valerie the YouTube link.
So this is Valerie Nelson. I have another question then. So is this the insurance for all of our employees?
All full-time eligible employees.
So we need to get it to our employees, right? Mine are out in the field, so they're not a part of this discussion.
Yeah, if they're full-time, Val, they need to get it. This presentation is going to be recorded, and they can watch it again. Letitia will send it to us or tell us what link to go to watch it for them.
Okay, perfect. All right.
Yes, it's being, like I said, it's being recorded, so I'm going to create a YouTube link so that everybody has access to it.
Okay.
Letitia,
you know when that,
Amanda
you know
has
when that might, I'm sorry. I'm
it looks like Amanda
when that might be.
Go ahead.
I think Amanda's mic is not working, but she had a question in regards to the enrollment form. So she said she only saw the PPO plan. So the PPO plan should be there. The DHMO option should be there as well. I'll take a look in the event that it's not and send it out.
Okay, thank you.
You're welcome.
So do you think that this might be on the YouTube thing for tomorrow? Because I have a staff meeting tomorrow, which I'll have all my team here.
Yes, I will send it out as soon as we're done. It takes just a minute to convert, and then I'll send it out after I review the forms and send it out. And anything that I missed in regards to attachments, Valerie, if you can just let me know, and I'll be happy to attach those along with the YouTube link.
Wonderful.
Excellent.
All right.
Thank you.
Thank you guys so much. Have a wonderful day.
You too. Thanks, Letitia.
Thank you.
Bye.